Encephalitis, an inflammation of brain related to infectious, post-infectious, or demyelinating states. It can occur as an acute febrile illness associated with headache, seizures, lethargy, confusion, coma, oculomotor palsies, ataxia, abnormal movements, and myoclonus. Alternatively, it may become evident as a slowly progressive afebrile disease. With viral infections, the meninges in meningoencephalitis or the spinal cord in encephalomyelitis are often involved. Compared to the high incidence of systemic viral infection, encephalitis is an uncommon complication. Prognosis of viral encephalitis depends on the causative agent. For example, herpes simplex virus and the use of antiviral agents. Variable degrees of residua include impaired cognition and memory, behavioral changes, hemiparesis, or seizures. Transmission of viruses can be from humans, for example HIV, animals, for example rabies, mosquitoes, for example St. Louis and Japanese encephalitis, ticks, for example Central European encephalitis, or other arthropods. Endemic causes in the United States are herpes simplex virus and rabies. Japanese type B encephalitis is the most common epidemic infection outside North America. Arthropod-borne viruses, arboviruses, tend to be sporadic or epidemic. Viruses enter the central nervous system by one of two routes: hematogenous, most common, or neuronal. Diagnosis may be difficult and can sometimes be made by history alone. The season may help determine the causative agent. Examination of the CSF shows a pleocytosis, mostly mononuclear cells, and mildly elevated protein levels are usually seen. Glucose levels tend to be normal. Red blood cells can be found in certain encephalitides. For example, those caused by herpes simplex virus. Determinations of antibody levels in serum and CSF during acute and convalescent stages typically are only useful retrospectively. Viral causes. Herpes simplex virus encephalitis, HSV type 1. Most common cause of fatal viral encephalitis in the United States. Most cases represent reactivation of endogenous infection. Onset is usually subacute, and fever, headache, behavioral changes, seizures, and focal signs are common. Stupor and coma may result. The EEG is typically abnormal, often showing periodic, lateralizing, epileptiform discharges, PLEDs, or other focal abnormalities. Spike and slow waves are common and are often localized to the temporal lobe. CT scan, although less sensitive than EEG, may show temporal or insular low densities and focal hemorrhages or enhancement. MRI may show increased medial temporal lobe signal intensity on T2 weighted sequences. CSF is rarely normal. It usually contains 50 to 100 cubic millimeters of cells, elevated protein levels, normal glucose levels, and elevated opening pressure. Red blood cells may be seen. A fourfold rise in titer HSV antibody, and CSF is 90% sensitive and 80% specific, peaking at 4 to 6 weeks. Serum. CSF HSV antibody ratio of 20 or less is diagnostic, but is usually not positive until day 4. Untreated, HSV type 1 has a mortality rate of about 70%. Severe neurologic sequelae occur in most of the survivors. Acyclovir, 10 milligrams per kilogram every 8 hours for 10 days, significantly reduces morbidity and mortality rates, especially if started early. Brain biopsy should be considered in those who do not respond to therapy or in patients for whom other diagnoses are possible. Rabies. Carriers include skunks, foxes, dogs, bats, and raccoons. The virus is in the saliva and is transmitted by bite. Incubation is from days to months. Not everyone bitten by rabid animals contracts the disease. However, once the infection is established, death is almost invariable. The prodrome usually consists of headache, malaise, agitation, mental changes, seizures, dysphagia, dysarthria, facial numbness, and spasm. The medulla and pons are most frequently and extensively involved, and paralysis may occur as a result of spinal cord involvement. Treatment consists of mechanically scrubbing wound sites with soap and benzalkonium solution and administering human rabies immunoglobulin or human diploid cell line rabies vaccine. Death invariably results once CNS manifestations occur. Epidemic encephalitis. Primarily arthropod transmitted viral diseases with a peak incidence in later summer and fall. In the United States, St. Louis encephalitis is the most common. It occurs in the Ohio-Mississippi River Basin and has a mortality rate of 10 to 20%. Venezuelan equine encephalitis is found in the southeastern United States and has a very low mortality rate. Most infections result in flu-like illnesses. Eastern equine encephalitis occurs along the Gulf of Mexico and the Atlantic seaboard, usually affects horses and birds, and is rare among humans. It has a mortality rate of 25 to 75% and attacks the young and very old with a fulminant severe course. Western equine encephalitis occurs in the west and southwest, and in central North America and California, virus encephalitis, with a low incidence of overt disease and low mortality rates. Occurs in the Midwestern states. Treatment is aimed at controlling brain edema and seizures. Non-epidemic viral encephalitis. Enterovirus, enteric cytopathic human orphan virus, ECHO. Coxsackie virus, polio, measles, mumps, Epstein-Barr virus, rubella, varicella zoster, lymphocytic choriomeningitis virus can all cause sporadic encephalitis. And that is encephalitis. Have a great day.